if you're getting together with the family at Christmas, I'm wondering if the conversation at some point turns to the question of care. Maybe you'll ask for a bit more care. Maybe you'll suggest it for somebody in your life. Maybe you'll want to have a conversation and need help. If you're thinking about downsizing, if you're thinking about trying to put together a RAD, a refundable accommodation deposit, if you're wondering what all of this means with recent changes, so much to discuss, right? Let's talk to someone who lives her life in this space. Rachel Lane's the principal of Aged Care Gurus and author of Downsizing Made Simple and Aged Care Who Cares. Last time she was on, we had a huge response. Rachel Lane, good morning to you.
Good morning, Leon.
Rachel, great to talk to you. My hypothesis, Rachel, is this is often the time when these conversations happen. We're close to loved ones, we notice changes, we might choose this time to ask for help. Is that your assessment of this time of year?
Absolutely. This is the peak time when people have these conversations. And it's often because, well, there's a number of factors, but it's often because they may not have seen their parents for months, perhaps even since this time last year. And it's also because they've got all of the siblings together. And so they can talk about these things together and, try to work out a plan of how they're going to best help.
And of course, I'm thinking about it from my listener's perspective, who might be that person who's thinking, maybe it's time we talked about a change for us with the kids. And then sometimes it can be overwhelming to even think about it, and maybe a few extra hands, people that love you, can make what seems really complex a bit easier. Rachel, how do you start the conversation?
Yeah, it is a very tough conversation. And I think it's really important to have a with you rather than a to you approach. So it's really important that older people have a say in where they would like to live and the care that they would like to receive. And so I think rather than having that, this is what we've decided is best for you, it's far better to have that sort of round table approach to, well, what would you like? What care and support do you need? How do we help you to navigate that process? And it might be that the kids or a combination of family, neighbours, people from the church chip in to help them out. But the one thing I would say is it's really important to get on that list for an aged care assessment as soon as you need care. A lot of people avoid these conversations and avoid that assessment because they think it's a slippery slope to a nursing home. And that's just not true at all. So more than 1.5 million Australians received aged care last year, and less than 20% lived in an aged care home. The overwhelming majority of people are not living in residential aged care when they get their aged care services. But that doesn't mean that they're staying in the family home that they've always lived in either. So a lot of people are making downsizing decisions, like, moving into a granny flat with their kids or their grandkids, downsizing into a retirement community, or just downsizing into a lower maintenance home.
And if you make that decision early, what do you see when you deal with families, Rachel? My perception is, if you deal with it early, maybe even a little bit before you when you actually need it, it makes things so much easier than if you're doing it in a crisis. If you're in a partnership and one of you's in hospital and then you're trying to make decisions, it can be so much more complex at that point.
Absolutely. And the choices you have at that point are what's available to you in a very short period of time. So if you're thinking about that you'd really like to downsize into a retirement community, for example, you've got to understand that there can be long waiting lists. And when I say long waiting lists, sometimes those waiting lists can be 3, 4 or 5 years. So sometimes I think people avoid having an aged care assessment or having these conversations because they think that things are going to start sooner than they're ready for them. In reality, we know that there's more than 120,000 people at the moment waiting for an aged care assessment, and more that have been assessed that are waiting for their home care to start. In October, I think the number was about 266,000 Australians are waiting either to be assessed or for their services to start.
And so it's easier to go from
really
a category 1.
To get onto it.
I know there are new categories now, but let's go back a few months to the system I'm more familiar with. It's easier to go from a Category 1 to a Category 4 than it is to get on the list in the first place. You're better getting assessed now, even if you're not eligible yet, but they know that who you are, where you are, and what you might need in the future. It's good prep.
Yeah, look, I don't think there's any point applying if you're not eligible. So sometimes people say, well, I don't actually need any care, but maybe I will in 18 months' time, so I'm going to apply for an assessment today. There's no point in doing that because you will be assessed based on your care needs today. But you're spot on when you say you might have very low levels of care needs today. And they may increase over the next 18 months, but waiting 18 months to start that process isn't the answer. The answer is to apply now and get your care needs reassessed in 18 months' time.
I know any advice that you offer today is general in nature only, but my guest this morning is Rachel Lane, principal at Aged Care Gurus and author of Downsizing Made Simple and Aged Care Who Cares. Look, let's focus on downsizing. Rachel, so often people get confused, and understandably so. If we downsize, we'll have money in the bank sitting for a period of time. Like, what will that mean for our pension? What will that mean for, our tax treatment? What will it mean for a whole range of things? Like, the finances can get incredibly confusing and concerning. What advice do you have for people about that journey if they're thinking about putting a refundable accommodation deposit together, downsizing and so on? What advice do you have?
Okay, so refundable accommodation deposits, that's what you pay if you're moving into an aged care home. When we're talking about downsizing, we're typically talking about people either downsizing into a smaller home or an apartment, moving in with kids under a granny flat arrangement, or downsizing into a retirement community. Look, there's so much to think about. And I guess the thing is that unlike when you're upsizing your house, let's say you're going from 3 bedrooms to 4 bedrooms to accommodate a growing family, the number of properties that are available to you are shrinking. And if you go up to 5 bedrooms, there's even fewer choices. But when you're downsizing, you've literally got this smorgasbord of different options, in inverted commas. You've got the normal options, which is freehold or strata title. And then these more exotic options around, granny flats and retirement communities. I always encourage people to do an exercise called the ingoing, the ongoing and the outgoing. Because it's very easy to sort of use rules of thumb and compare different options based on the purchase price. But when you're doing that, especially if you're looking at granny flats and retirement communities, you're ignoring 2/3 of the transaction. You're ignoring what it's going to cost to live there. And really importantly, you're ignoring how much you're going to get back and how soon after you leave. And that's crucial if you're thinking about the possibility that you might need to move into residential aged care and fund that RAD in the future, or if you're thinking about how much money might be left to your estate. So do that exercise of the ingoing, the ongoing and the outgoing. And the outgoing is obviously the tricky part, right? Because that's where exit fees come in, and that's certainly the bit that causes the most confusion. In a granny flat, the exit fee is normally 100%. In a retirement community, the exit fee can be anything between 0 and 100%. It's normally directly related to how much you pay up front. And there can be other components to it as well. So there can be normal, if you like, property components around sales commissions and marketing fees and renovation costs. But you can also have a situation where you share in capital gain and capital loss with the retirement community operator. So it's really important to crunch the numbers on that. And be conservative with those numbers. Sometimes I hear people talking about, I'm going to crunch the numbers based on 7% per annum capital growth. That's far too aggressive. It's far better to look at perhaps a 3% capital growth. If you end up getting more than that, you won't be disappointed, obviously. But over the long term, I know that recently properties have gone through substantial growth. But over the long term, 3% is more what you should be looking at.
It's a challenging time. These are exactly the sort of conversations lots of us are heading into. Rachel, thank you for adding your experience to the story this morning.
You're welcome.
Rachel Lane, Principal Aged Care Gurus. Her advice is general in nature only. She's also the author of Downsizing Made Simple.